So today we're doing the spinal examination. For any patient, any examination, you start with any patient coming in, you start with the inspection. So initial inspection, the gait, how the patient is walking in, gives you a bit of clue. Obviously then you do the palpation, palpate for tenderness, you do the relevant special tests. You look for power, touch, sensation, neurovascular examination, and towards the end, obviously, if there's any other special tests or diagnosis. So we start with our patient. If you come in, please. So first of all, I'll be looking to his gait, how he's walking. He's done in front of me, and he's just looking in generally how the physique is, any wasting, any different things that you could look into. So the first thing we start with the inspection. So you look into general posture. The patient ideally should be covered, should be all uncovered, only wearing shorts ideally. Unfortunately, this is the situation at the moment. So we stand behind, so you look for the curvature of the lumbar spine. You keep standing straight, whether it's rightly curved or not. You look for any obvious kyphosis, any scoliosis, which you would get from looking from the back and from the sides. Any other obvious deformity, bruising, anything that you could see from inspection. Now the next thing would be to start with movement. So the movement will involve, so I usually tell the patient, just copy my movement, alright? Okay. Go down and touch your toes. There you go, and go back. So it's got good flexion of this for forward flexion. And go back as far as possible. Good extension of the spine, hands back, or backward flexion. Now if you twist it on one side, twist on the other side. So good movement of the lumbar spine, good rotational movements on either side. Now if you slide your arm on one side and then slide on the other side, so good lateral flexion of the lumbar spine on both sides as well. Okay, the general movement. The way we've trained and as a GP, you usually have only 10 minutes, so I try to do quick examination. One quick way of finding out what the powers in these the legs are is to ask them, can you get on your toes please? So it gives you a rough idea. And if you go on your heel please, that's it. So that gives you a rough idea as the power is 5 or normal in the legs. That's fine, thank you. So that's a quick movements, active movements. Now, if you lie down in the couch on your tummy, so we go on to the palpation. With palpation, obviously, if you come in here, please. With palpation, the best thing to start with is lying in prone position. Now, obviously, to start with, what you would do in the lumbar spine is to press in the middle or in the spinous processes. Can you tell me if it's painful? So it's not painful, and you go down all the way to the bottom to check for any tenderness. Similarly, what you would do is the paraspinal muscles. You press on them, and that is a common cause. If it's a mechanical back pain, there would be tender on one of the paraspinal area, and then you press on the other side as well. Similarly, so that would be your palpation. Now, if you lie on your back, please. Carry on with the palpation, and the rest of the movements would be to do certain other tests of the lumbar spine. So one of the common tests is the SLR, or straight leg raise test. So if you could raise your right leg without bending the knee as far as possible, that's it. Yeah, so it's got a good SLR. You can see that up to 60-70 degree, which is normal. And I'll press. So is there any pain with that? No. So you basically, what are you doing? You're stretching the sciatic nerve by doing that. And if he's got radicular pain, a disc pressing on the sciatic nerve, he will start having pain on doing that movement. And obviously, because when he raises the leg straight, the sciatic nerve is stretched, that will cause him to not to raise to higher degrees, and he will stop doing that if it's positive on either side. Similarly, you would do the other on the left hand side. Can you raise the leg without bending the knee? So it's got a good straight leg raised up to 60-70 degree, and then you would do the sciatic stretch test, which is negative again, he's not in pain. So that's one of the common special test of the spine. Testing for power, ideally, as I said, he should be just wearing the shorts and you're looking at the muscles. A quick way of doing the power, which I usually do, check different dermatomes is, so can you pull the toes towards yourself, push the toes on me, pull the ankles towards yourself, push the ankles on me, good. Now bend the knee for me, pull it towards yourself, push on my arms, good. Now the other one, push it towards yourself, push on me, sorry. Yeah, that's it. And again, so you're checking different flexor extensions or different dermatomes, and try to raise your legs, good, and bend down, good. Now bend outwards, good, and inwards, good. You're checking the power in different muscle groups. In his case, it's all 5x5. He's moving all the legs well. Similarly, if you're doing the rest of neurological tests involving crude touch sensation, temperature, and pain, he should be ideally stripped, just wearing the shorts. Roughly what I would do. Can you close your eyes for me and let me know when I touch you?
Yes, 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 yes.
Now ideally you can open your eyes. For lumbar spine examination, neurological examination, you should be testing around the perianal area, and you should be testing a rectal examination, putting your finger inside to check the anal tone. So that should be part of your examination. There's another special test. Now, can you slump in the chair? What we call it slump test, where the patient will basically slump in the chair. So what the slump test would do, it will put, again, testing for radicular pains, where disc is pressing on the nerve, is where in the way he's sitting, it's extra pressure on the spine, so his neck is forward and his legs are bent. But what I would ask him, can you straighten your leg for me, the right leg, without bending the knee? That's it. So what that test is doing is basically stretching the nerve, the sciatic nerve again. The same thing we did for SLR. And in this case, and I will do the sciatic stretch test, he's not having any pain, you can bend your knee back. So that's all negative. But in a person who's got sciatica or disc problem, he might not be able to straighten the leg. He will give you maybe 20 degrees, 30 degrees, 40 degrees or something like that. But in this case, he can do more than that, up to 80, 90 degrees. So you can know the what the angle is and how much the improvement is in the future examination. You can monitor it and do the same on the other side as well to stretch it and slump forward. Yeah, that's it, and that puts the pressure on the nerve. That's fine, thank you. There are certain other special tests, but for the time being, for the examination of lumbar spine, it's a quick lumbar spinal examination. Thank you.